and my cough is dry or wet and it's a regular problem with me. I get a wheezing sound and tightness in my chest. Cough is one complaint that just does not leave me. Whenever I have a cough, my cough lasts for days, sometimes weeks, and over a month. And my cough is dry or wet, and it's a regular problem with me. I get a wheezing sound and tightness in my chest with my cough. I sometimes have fever and I feel very exhausted. Does all of this find familiar to you? If it does, then you could be suffering from what is called as bronchitis, commonly known as an allergic cough. Hi, I'm Dr. Seema and welcome to my channel Cure from the Core with Homeopathy, where we speak about how the science of homeopathy is going to help you to find a permanent cure to your problems. And today we are talking about bronchitis. So if you have allergic cough, if you're suffering from bronchitis, this video is going to give you good pointers to help you deal with your problem from the core and find solution to your problem. Stay tuned and watch the video to the end. To understand what is bronchitis, let us look at our respiratory passage. When we breathe in air through the nose, the air enters from the nose to the throat, and here is our windpipe. From the windpipe divides into two branches, the right and the left, into the lungs, called as the bronchi. These are the primary bronchi, which further divide into secondary and into tertiary bronchi. Towards the end, there are smaller bronchioles and our air bag. In this structure of our lungs, inflammation of this large and medium airways is what bronchitis causes. It is an infection of the lower respiratory tract in which large and medium airways are inflamed. Inflammation is nothing but an irritation in the skin of the bronchi, which causes redness in that part, which causes the inner skin to swell up. So this is the opening of the air passage, and when it is swollen, it decreases in size. Because of this inflammation, the swelling occurs. Because of the swelling, there is a mucus discharge which further blocks this opening, making it more narrower. Difficulty in breathing, tightness in the chest, a wheezing sound while the patient is breathing are all the signs because of this, and there could be infection, fever, along with it causing lethargy. To understand the causes of bronchitis, we need to know what is acute bronchitis and what is chronic bronchitis. Acute is a shorter duration infection lasting for a week to 10 days, over 3 weeks, sometimes over a month. Chronic bronchitis is something which is a constant regular cough on most days of the year, at least for 3 months and few such consecutive years. The causes for acute bronchitis are 95% viral infection. Pollutants that are all around, viruses that are all around us, when we inhale them, it causes the complaints of bronchitis, and that's what reminds me to tell you that antibiotics do not have a role to play. Rather, antibiotics delay the progress and the recovery and hence should be completely avoided. Chronic bronchitis, you see here, smoking is one very important cause for chronic bronchitis. Also, people with occupational hazards, working in mines, working on streets with exposure to dust, inhalants, metal, grain particles, those are all the causes of constant cough or chronic bronchitis, and eventually in both the cases you see how the lumen decreases, becomes smaller, there is mucus production, infection, and that's what causes bronchitis. Let's understand the role of homeopathy in bronchitis. Coming to the basic principles of homeopathy, individualization. A homeopathic doctor identifies every patient as an individual with a specific and a different pattern of complaints, and based on this identifies a unique remedy for this person on the principles of like cures like. Explaining like cures like, a substance which has the ability to bring about a set of complaints will very much be able of curing the same set of complaints in a diseased person. Applying this philosophy, a homeopathic doctor in acute bronchitis will look at LSMC. L stands for location. A lot of times, allergy could settle only in the nose, but in case of bronchitis, the allergy travels down to the airways, and this location is very important for the homeopathic doctor to take into consideration for his unique remedy. Sensation is the experience felt. Like for tightness, a patient can describe this in his own words as a stony, heavy feeling on the chest. Some patient will describe this as a pinching or a stitching pain that occurs in the chest. All of these, in the patient's own words, are very important for the doctor. M stands for modality. Modality are the things that bring about and modify the complaints. For some patients, the cough is worse in the night. For others, it is worse in the morning. For some patients, evenings the complaints are more. All of these factors are important for the modality. For some patients, drinking warm water can relieve the complaints, and for others, it could bring about worsening in the complaints. Concomitant C are the accompaniments with the cough. There is fever, as we know it's a viral infection, and entire body participates in the phenomena. Is there a muscle pain? Is there total weakness? Is there hyperenergy? Is there joint pain? Is the patient thirsty or hungry? All of these individualizing features are important for the homeopathic doctor. This brings into my mind a case of a 7-year-old who was complaining of cough and breathlessness, describing a sense of tightness, and that made her to sit at one place. In the night she couldn't sleep and the parents had to give her nebulizer. When a unique remedy was selected for her based on the LSMC, in couple of doses she felt much better, and that night she slept well. And the parents came to me and told me that. However, the medicine did continue for some time. So this is the management in an acute case, whereas in a chronic case, it's an entirely different pathology. And this is a part of chronic obstructive pulmonary disease, COPD, needs a longer management, where an entire picture is taken at the level of mind, at the level of emotions, other physicals, and a unique remedy is prescribed on like cures like. In another video, we'll take this in more detail. Some of the important remedies for acute bronchitis are Calibicrome, Spongia tosta, Drosera, and many more. Again, friends, I will urge you to not take any over-the-counter medicine, but visit your homeopathic doctor. Take the process of individualization, find out your unique remedy, and that remedy is going to help you best to deal with your complaints. I hope that you found this video helpful in understanding your problems and also in guiding you towards finding a solution. We get many requests on one-to-one help that is needed, and for this I'm going to leave a link in the comments, and do click on the link if you want a 15-minute free guidance call. We'll be happy to help you. Do let me know in the comment section your feedback and your questions. I'll be happy to take them up. Also, let me know what are other topics you want to know more about and find solution to your problem from the code. Thank you very much for joining me from wherever you are joining here. Thank you for watching this video to the end. Stay healthy and stay happy.